What are Colourpuncture information barriers treatment? Information barriers treatment is a family of Colourpuncture treatments which we consider to be opening treatments. What is an opening treatment in Colourpuncture? Probably you heard about it if you learned basic Colourpuncture, but I will remind. So, for example, you have a patient who presenting with clear endocrine problems, hormonal problems. So all they need is basic endocrine. Basic endocrine is a really well-known treatment, really effective for most people. Sometimes what happens, you give them basic endocrine, there is some effect, but it's not the effect you feel you can get. So likelihood is this is a treatment we need, but they're not responding for some reasons. This could be therapy resistance, this could be something else, there could be secondary gains, it could be body constitution, there could be multiple reasons. The focus today is not on why this is happening, but rather what to do about it. So imagine a room, you need this room, but the door is locked. The door is closed and there is a lock on the door. So your room is your endocrine treatment and all the multitude of benefits which comes with it. But the door is locked. So how do you unlock the door? How do you open the door? There are many ways to do it. And today I want to focus on one, which is often very overlooked. If you learned endocrine basic pattern, and if you're familiar with Colourpuncture in general, one of the very first treatments you will learn is actually information barrier thoracic 12. And thoracic 12 information barrier we usually treat in ultraviolet color, or you can do it in violet color if you want to do it more as a substitute of ultraviolet, which is the main color for thoracic 8. But if you want to go on more bodily level of it, then you can use orange. So this is something that you're probably familiar with. And we do it to establish a flow of communication between the head, the mind, and comprehension, and everything, our logical faculty, and the rest of the body, namely the belly, and all the sum total of feelings which we hold in our bellies, and so on. So what do? First, we need to open the door with some treatment. Thoracic 8 information barrier is just one of the ways to open the door. I found in my clinic specifically, somehow my patients needed different information barriers. And if you remember from Colourpuncture, any vertebra can serve as an information barrier, meaning that this flow of communication between our head brain, so to speak, and belly brain is interrupted at some level. And it could be for many different reasons. And each vertebra traditionally has certain features, certain characteristics, certain character associated with it. And there are physical correspondences, there are psychological correspondences, emotional, spiritual, you name it. So thoracic 8, in a way, this is like a main barrier. This is very often something that we start off with when we are treating therapy resistance. So plan would be you do your thoracic 8 information barrier in whichever color you want, and then you can go in with your basic endocrine, and then you do some nice finishing treatments such as triangle of tranquility, for example, or triangle of emotional strength, anything along these lines, and then your patient feels wonderful. So if this is not happening with your thoracic 8, again, you can try any other vertebra. The full knowledge of it comes in our module 7, which is first module of advanced Colourpuncture. Colourpuncture consists of 12 modules. So this is number 7 if you just number in the modules, or this is number 1 of advanced. And in this module, we learn about different information barriers. So there is information barriers, the information points on the head, which basically projection of information barriers on a microsystem of the skull. So we treat 2 points here, which is very beautiful, one for cognitive brain, another one for emotional brain. Each of those points can be made into a line, and then we treat 2 lines, one for cognitive mind and another for emotional mind. This is one of my favorite treatments. I highly, highly recommend informational lines. If you never tried them, you will have endless insights. If you can just do it every day for a while, it's amazing. I cannot praise it enough. Anyways, then we can do information barriers on the feet, information barriers on the hands, and we can also do information barriers on the ears. And I love auricular color puncture in general. Everything you do on the ears will provide a really deep relaxation for your patients and for yourself if you're doing it for yourself. However, some treatments, some auricular color puncture treatments, which are all based on auricular acupuncture, basically, most of them, they will provide you with some bodily relaxation, some emotional resolution, this kind of thing. But thoracic 8 will provide you with something much deeper. If your patient really is not responding to therapy, I would highly recommend you use thoracic 8 in the ears, just this one little treatment. Or you can do the whole series. You can do 2 points, and then you can do the lines, you can do the feet, you can do the hands, and you can finish off with information barrier of the ears. So continuing within this same topic of information barriers, but now coming back to the spine. Now think about it. There are many connotations with the spine. First, the spine this is a source of nerves of all our organs. This is we can underestimate this or overestimate this. This is just basic. So the spine is like, I don't know, the very foundation of tree of life in this particular sense. Each vertebra has indications, but also in Colourpuncture, we consider spine to be a soul axis. So when there is some problem, some issue with the spine, either emotional in a way is that not emotional issue with the spine, but emotional in a way is that, for example, when we are stressed, we work long hours and we sit in a particular position, we compress particular areas of our spine. And that happens because of stress, because of emotion, and so on. So even though the resulting issue is very often degenerative, actually, in effect, because they have disc problems, they have this, compression problems, trapped nerves, and so on. The primary issue is that of stress, and so emotions, and so on. It could be a physical degeneration with time, with age, simply just plain and simple aging process can give you that. And anything can affect it. So each vertebra can serve as information barrier. And I mentioned C1, which is cervical one. Now, cervical one, obviously, this is the very first vertebra. It's the very top of the spine. And this is so important for many different reasons. It's just very hard to overestimate. So starting with, for example, physical issues. We have all problems and stresses in the head. We had anxiety, we had fear, we have stress-related and all other types of headaches, obviously neck strain and so on. This affects a lot. But also what it affects is a lymphatic drainage from the head, and the face, which is highly important. And very often this is the very first step in development of bad processes in the body. In Colourpuncture, we had 3 levels of lymph, so to speak. There is a head and face lymph 1. There is a chest lymph, which is lymph 2. And there is a belly lymph, abdominal lymph, which is number 3. So if the lymph from head and face doesn't drain properly, then everything is a problem here down the line, because basically don't stream, because if the lymph stagnates here, there is no movement. And if there is no movement, not only you will have problem here, but you will also have problems in the chest, including the breast for women, in the belly, with all kind of digestive and immune system problems and so on. So I would encourage you to try and look at information barriers as something very beautiful and very specific. All 26 of them form like a microsystem in Colourpuncture. And look up individual indications. So, for example, if coming back to this hypothetical endocrine case, very often we have, for example, women with menopausal symptoms, and that could vary from emotional turmoil to hot flashes to all this other bodily unpleasant menopausal system. So for this, for example, we would need different information barrier, which is sacrum, which is completely different. So sacrum has 3 levels, but we can treat it as one information barrier. And very often, this will be your key to this door, to this basic endocrine pattern. So, for example, let's see how you can treat the information barrier. I'll show you with the C1, but it is all the same for all the other vertebrates as well. Obviously, you need to know exact indication, exact positions for each vertebra if you're going to use this, or if you have Colourpuncture materials. If you have any questions, please reach out. I'm happy to help. So, for example, for C1, the color is violet. And first, we actually treat the C1 in violet, as where it is, where C1 is, cervical 1. Then we treat satellite points in the same violet. And then we treat side points and front points. Now think about this one for a moment. And this is why I love it so much, because it just does so much, this particular line. So we treated these points, information barrier as it is, vertebra C1 as it is. And then when we transfer it to face and sides, we come to our TMJ points. We come to our points which we call the laterality point, or general point of lymph drainage in Colourpuncture. Isn't that beautiful? This is really powerful treatment in itself, just those 2 points. And then we transfer, we continue the horizontal plane, and it comes to nose acupuncture for pancreas. Nose acupuncture is another microsystem we use in Colourpuncture, and this is really beautiful microsystem in its own right. But I don't want to stop on it. I just want to mention that the front point is pancreas point from nose acupuncture, and then we do satellite point. And this is how we treat every vertebra. So, for example, if you would like to address sacrum for endocrine case, then you would use orange color, because this is just color for this particular vertebra. And what you do, you treat the sacrum, and then if you palpate the sacrum on yourself, and then you make this horizontal plane, so you transfer it to the side and then to the front, you will discover that you will end up on the front near Kundalini line. So how beautiful is that? With each vertebra, again, there is a specific protocol. There is a specific location rather than protocol. The protocol is always the same. This is a back point first, satellite points, side points, front points, 8 points altogether. Colors are different, and indications are different, and you need to know exact positions. So I would highly encourage you to try. This is a beautiful, beautiful, beautiful treatment. And this is often overlooked. I'm not sure why. Probably because it seems very simple. It just seems very simple. Probably because we have such a multitude of options in Colourpuncture. This is just such a vast ocean that this is not something treating individual vertebrae, looking up indications and comparing with the medical history of the patient is not the first step usually when you learn Colourpuncture, when you start your practice. But in my Colourpuncture practice with years, I'm using this more and more and more, because I can just see how effective this is. And so, for example, if you have a patient who clearly is therapy resistant, and this is not your first session treatments, obviously. However, if somebody is clearly therapy resistant, or there is a known problem with the spine, or they have all the indication for a particular vertebra, I would encourage you to try fairly early on in spectral colors, because again, information barriers, the main colors are UV and IR. And many, for example, Th8 is excellent in crystal puncture, with crystal puncture tattoos as well. However, I would encourage you to try first with spectral colors and see on a body level how it works. Because remember, we always start with the body. Because sometimes the issue could be very simple. Think about stress-related tension headache. We just see this. It's just everything is compressed. So why don't we give a chance with the spectral colors first, and then we go and explore spiritual dimensions, emotional counterparts, and all the rest of it, which is equally beautiful, don't get me wrong. However, the start is simple. This is spectral colors. Each vertebra has a color. So C1, in our example today, C1 is violet, all points are in violet. Thoracic 8, which you probably know already, could be done in UV, in violet. It could be done, again, instead of ultraviolet, could be done in orange, or it could be done in light turquoise for more soul issues, more for emotions, feelings, not enough integration of life experiences, kind of thing. And the sacrum can be done in orange. And I would say that orange is a really, really color that you need to go to for the sacrum for quite a number of sessions before you can move on somewhere else. So I hope this helps. And if you have any questions, do let me know, and I would be happy to help.